Okay, so I'm going to be testing this patient for cervical myelopathy. So some signs and symptoms of cervical myelopathy include neck and shoulder pain and stiffness, low back pain, loss of hand dexterity, poor handwriting, and a clumsy gait. And to screen for cervical myelopathy, we do the Cook's cluster, which is look for gait deviations. If the patient's over 45, they're at risk. And we do Babinski's sign if it's positive, Hoffman's sign, and inverted supinator sign. So I would do a gait test, look for gait deviations, ask the patient how old they are, and then I would do the inverted supinator sign, which is the brachioradialis reflex. And hers is normal, which is extension, but a positive sign would be flexion instead. Then I would do the Hoffman's test. And you flick the distal phalanx of the middle finger, and a positive sign would be flexion of the index finger and adduction of the thumb. And then I would do Babinski's. I would look for Babinski's sign. So I would just drag a sharp object up the foot toward the great toe, and a normal sign is flexion of the toes, but a positive sign of that would be if it was the fan sign, which is extension of the great toe and abduction of the rest of the toes. So if she were to test positive for any 3 of those 5 signs, then she would have cervical myelopathy.